When the phone rings, the client, that's probably the hardest thing that they do is call us. They're scared, they're afraid, they feel broken, they feel like they've lost hope. So we encourage them that this is the starting of the healing and that we can help them through the journey together.
They're all typically scared and anxious, so we have to provide them with the safe support to begin this journey.
Not only are withdrawal symptoms extremely uncomfortable, sometimes it's even life-threatening with inadequately treated withdrawals. And by providing comfort, it allows the patient to be able to engage in treatment a little farther down the road.
When they get to us, it's a wide variety. It could be somebody that's not feeling well, still in bed, and we have to go see them in their room, or they come to us and they're ready to go. What we do when we meet with the patient is just introduce slowly that 90-day treatment model, whatever that may look like, inpatient, followed by outpatient, followed by extended care, or still waters, whatever the next level of care may be. The counselor will set up a continuing care plan or give us the recommendations, and then in case management we facilitate setting up whatever those recommendations are.
So a lot of times when the women come to treatment, they have guilt, shame, feelings of inadequacy, and a lot of times, unfortunately, they believe that they are undeserving of recovery. They tend to think that living a life without the drugs and alcohol is impossible. And so when I work with the patients, I try to hone in on the 12 steps to help them see that there is healing in that. Try my best to give them hope and understanding, and hopefully by doing that, I'm able to roll into the length of stay and how 90 days is definitely recommended.
Usually they're a little anxious when we first start talking about length of stay. I think the conversation usually for me comes up during treatment planning, and that's usually when I first start talking about 90 days of clinical involvement at a minimum. And a lot of times they're asking, why 90 days? And a lot of times, I have a little hot link to a government website, the National Institute of Drug Abuse, and that's where I will show them that treatment, lasting less than 90 days is of limited effectiveness. To see really positive outcomes, we want to have them involved in clinical services for significantly longer than 90 days.
Patients come to me, I look at them as body, mind, and spirit, and using music to heal the body is a lot of science has proven that it can change the physical makeup of the body and the brain. Music can get to places in people's minds, to memories and images which are helpful in recovery.
We meet with them and we reach out to whoever would be like sober support for them. We want to help them understand that committing to a lifestyle change and those first 90 days of recovery and 9 months of peer-supported recovery after that is the best way for them to change their life and to be able to live the life that they want.
I think the most important thing that I can do to help them is really kind of create the therapeutic relationship and the therapeutic alliance, helping them to feel comfortable, helping them to feel like they're in a place where they're not going to be judged or criticized, and just allowing them to kind of feel like they have a safe space for expression.
The nature of treatment is that people are coming in at a really bad time in their life. They're suffering, and a big part of that suffering for them is that they are disconnected in their lives from other people, from themselves, from their purpose, and from a God of their understanding. And so when we just look at the lens of spirituality as connection, we recognize that addiction is the opposite of that. So people come in all kinds of places with spirituality, but with a lack of a true, authentic spiritual connection. That's what unifies them all. And so we start with very basic concepts around the first 3 steps. We teach them principles for handling their life situations, and then we teach them spiritual practices like prayer and meditation and everything that means.
So a patient coming from residential setting, they've already kind of been immersed in have some education on what recovery is, what to expect from the 12 steps. So coming in here, I try to meet them with, now that you're out of that residential bubble, let's look at what life is going to bring. How do we deal with those stresses, reintegrating back into work or school, and how do I deal with the stress and the triggers that are going to come up? So meeting them with a lot of those tools.
When someone comes to our extended care program, what we are seeing is that they are usually very motivated for continuing their recovery. I say that because they've made a decision to stay longer. So what we are seeing is that in the residential phase of treatment, they are able to get the foundational pieces that they need, so much so that they're recognizing a need for continuing this process. And so what we're doing here in the extended care program is really bringing awareness to the present. We're looking at today. How can they recognize their addiction today, and how can they treat that? How can they manage that on a daily basis?
I start working with our patients usually a good week and a half, 2 weeks before they leave, just to kind of educate them on the alumni programming. My whole job is to connect our patients with the alumni community that I'm helping to build outside of Cumberland Heights. And so whether it be our recovery care advocates or our alumni events or our alumni care meetings that we have in the community, online and at our outpatient recovery centers, my ultimate goal is to bridge the gap between the education that's taking place in this center and at our outpatient recovery centers and the world of recovery that is literally the rest of their lives.